said that nobody, no governmental agency should tell her child what they should eat. I said, like, I get you don't like her as your first lady, it's fine. But if we don't control what goes into our kids' mouth at that age, then we failed. Okay? So when we're advocating, things like school lunch should be at the top of our menu as nurses.
Yep.
But
Absolutely.
she was pissed off.
Doesn't.
That they were changing school lunch.
Yeah, even though they tell us you have to have PE, like physical activity, so it's a difference, or just a diet.
Tasajo, no. Panapakan, no. Broccoli.
Mi niño le encanta
Tasajo, no. Panapakan, no. Broccoli.
Okay.
I saw that happen a lot of times.
Okay. And how do you deal with that?
Tasajo, no.
There you go. At least you did the little things. Right? So, when we look at health promotion, we have to look at it from all aspects. It's not just in the clinic. We have to change government policies. Okay? So we have to look at policymakers, stakeholders. These are the things. So when we're doing our health fair and we're going into the city of Hollywood, when we identify needs, we need to make sure that the commissioner of health or the commissioners in Hollywood know that we're coming in there and we're gonna be interacting with the people of that population. Because we want them to understand that we see needs. Okay, and if there are things that we see, let's say that every 10 people who come by, each of them had an elevated blood sugar. They tell you that they have no healthcare provider because they have no insurance and they can't go anywhere, they don't see anyone. And you're a nurse at Memorial Regional. Okay. But how do you fix that? What do they need in the city of Hollywood to help with that?
More research for
Resources.
diabetes. More,
Yeah, but how?
Reach out to the
How do you get a clinic?
reach out to the commissioners.
Reach out to the commissioners.
The state rep.
That's good. They got your back. Social workers and Cape Man.
Maybe they don't know there is a marketplace. Maybe they can apply to the marketplace.
Well, maybe they don't know where the clinics are.
Maybe they don't know it.
I don't know,
But that's
contact the
thing about it.
endocrinologist.
If you're at
in
the health fair, you're having a health fair, part of you organizing that health fair is to make sure that the local clinics know that you're having a health fair, so that they can come and be represented. So that if you have these type of patients, you go, oh, can you go over to that area over there so that they can tell you how you can come in and see them?
Yeah.
Because this is a free clinic that you can actually go to. But if you don't have those
Okay.
resources,
Can they have a booth? Can those clinics gotta have a
they
booth?
can. They can definitely have booths. All of them can. The Memorial Healthcare Adult Van always comes to our health fairs. Okay?
Memorial
And-
healthcare what? Adult what?
The adult van,
Fun.
okay? We always invite them. And they come, they park, and people can go in. The last time we had the pediatric van, and they gave immunizations to a whole lot of kids. As a matter of fact, we had a kid who had not gone to school because he had no immunizations. He was missing immunization. And that day, he hated his mom because he must have got like 5 or 6 of them, all at once.
Oh my God.
And they were able to sign the paper so that he can actually go back to school. He was not going to school because his mother said she didn't have any money to take him to the doctor to get the immunizations. He got them that day for free at our health fair in the Memorial Pediatric Van. And he got the paperwork signed that day. And his mother could have taken him to school that day.
Can you get them for free in the health department?
They probably can,
I think that you can.
but you know
It's
what?
just going, they don't know.
But if they
But if you don't have an address, you can't get help from the, health, Department of Health. Do you know that? You have to have an address.
I know this, yeah.
If you do not have an address, you cannot. So, I always tell my story freely. I was homeless at 19. I was pregnant and homeless. I had no place to go, no one to stay with. And so, I went to try to get community assistance. And they were like, where's your where do you live at? And I didn't want to give my friends' address because I was sleeping on different people's couches. And so I was like, I don't have a home right now. I'm like in between. I couldn't get any assistance without an address.
Yeah, it's not.
So a lot of times people judge, but if you've never been there, you have no idea. You have to have an address. Some of these homeless people, they have, in Hollywood, the city of Hollywood, they have, I can't remember the name of it. But they go there and they get their food stamps there and they get their welfare check there. But they're homeless. But the reason they give them that ability is because they have to have an address to send it to. And if they don't have an address, you can't get access to anything. I couldn't get WIC, I couldn't get any of that stuff without an address. And then I was going to school on a full scholarship. And so they said, huh? You have a scholarship? You're in college? You can't get assistance because you're already getting money from the government. And I was like, are you serious? So, you know, I did the waterworks, cried like hell in front of the lady, and she was like, okay.
Give me a break.
She was like, okay, we're gonna start over. You're gonna find an address to give me. And you're not gonna tell me that you're in school. And then you're not gonna tell me about your scholarships. Because I was like, if I tell this lady I'm in school and I'm doing all this stuff, she's gonna be like, yeah, and give me everything. No. It was just like, blocked. So there are so many roadblocks that you do not know about that prevents people from getting assistance. A lot of times I hear people say all the time, they could just get this. There's so many things out there they could just do. But if you don't live it, you have no idea. There are a lot of things out there, but not all of it is accessible or readily accessible. Because there are things that you have to meet. You have to meet certain criteria. And if you don't, you can't get it. The biggest thing is an address. So until you get that address, you can't get anything. I was actually, you know what, and they told me, it's like you can go to the women's shelter and then you can get it through the women's shelter. Good thing my friend was like, hell no. And she called me that day, like, divine intervention. And she was away at college and she called me that day just to check on me to see how I was. And I was telling her all this and I was like on my way to the women's shelter because I wanted to get this stuff. And she was like, hell no. You're gonna go to my house, I'm calling my mother now, and you're gonna stay in my room. I'm gonna tell my mother now. And you can give them that address and you can get anything you need. And that's how I was supposed to get it. But what about people who don't have angels like me? You know? It's not as easy as it seems sometimes, okay? And I tell people all the time, I probably should be like a statistics, I should be like, have 7 children with 10 baby daddies, I don't know. And the project's going where, you know, but I had a lot of angels. And the reason I'm not there is because I had angels. And people don't have all that all the time. So we really have to look at those kind of things. And we can never be judgmental, okay? People tell me all the time, you dress like you're this prissy person, we're your only child. I'm like, yeah, I wish. I dress nice now because I know what it's like not to have. And if you don't ever know that, you don't know what it feels like. So you never judge, and you always try to find out what if. Because there are a lot of times there are government agencies that won't give you any help. And if you don't know this, you don't know how to guide your patients, okay? So, we talked about health literacies. Healthy cities. If I live in a city, if I live in a concrete jungle, it might be very difficult for me to exercise, okay? And for me to have a park there may not come easy either. So how do you deal with that? How do you deal with childhood obesity in people who live in concrete jungles? It is a challenge. It is a challenge. If they get help from like food delivery services, do you know what they deliver? Canned foods. They do not deliver fresh foods. So if I'm 65 and I get a food delivery service, I'm getting canned foods. And what's the first thing you tell them not to eat?
Sodium, canned foods.
For the soul.
Okay? It is always. So you have to look at what is available, okay? And when you're looking at promoting healthy cities, you have to use stakeholders. So it's governmental agencies, it's the schools, it's the clinics, everybody has to be involved. If you're the school nurse and 5 out of every 10 kids is obese, that's a problem. And you can't just go to these houses and say, you need to change the food. You're gonna have to use everything in your community to combat that problem. Okay? It's a lot bigger than that household. Okay? It's a community issue. Okay? Promoting healthy schools, strengthening the capacity of schools to be healthy settings for living, learning, and working. It was heaven when they started putting breakfast in school, because you have no idea how many kids go to school hungry. Okay. My niece, I took care of my little cousin. She lives with me. I took her from her mom several years ago, and she lives with me. She deliberately goes to school hungry, and I don't care. Because she has access to a full refrigerator, full of food. She has breakfast stuff. She has money. But she wakes up 5 minutes before, she has to shower, run, and catch the bus. But this is her. There are kids like that, and then there are kids that will do anything for breakfast, okay, and have no access to it. So free breakfast or free breakfast in school is something that you should always make sure is mandated for, okay? Especially if you take care of kids. If you work in a pediatric unit, these are things that you really want to look at. Or if you work in a clinic that takes care of kids, these are things that you want to look at. Because if you don't, kids go to school hungry, they can't learn. If I'm hungry, I can't teach, I can't learn, I can't think, because my brain doesn't work if I'm hungry. So can you imagine a little kid trying to absorb everything at that level? They can't eat if they don't, they can't think if they have no nutrients. So those are things we have to look at. Social mobilization. Okay? When we talk about social mobilization, what are we talking about? When we say social mobilization, what does that mean? Huh?
Different agencies.
Different agencies. I'm sorry?
Recruitment of different agencies.
Recruitment of different agencies, stakeholders. Okay, you're gonna hear me say that a lot. I said you have to look for your stakeholders. Okay, who in the community can impact change? Those are your stakeholders.
Several.
Giving ownership to the community is very important. If you outsource everything in the community, people feel like they have no control. Okay, so if you're going to impact the community, you want to look for the churches. You want to go by the churches. You want to go by the areas that the people hang out. These are the people who are going to help you to empower the people in your community. Okay, so you have to look at that. When you're doing your recruiting for your health fair, go to the churches. Give them flyers. Say, we're having a health fair. Can you tell your congregation? Because if you can't get them to go, the nurse can't, the pastor probably could. So these are things, you have to look at who influences the community and use that as your guide to help you. Disease prevention, looking at what impacts diseases and how it's impacted in those communities. Okay, early detection is key. Okay? I have a strong familial history on my maternal side of hypertension. I tell them on a daily basis, they have given me no money in life, so they will not give me their diseases. So I do everything to prevent that gift of disease, okay? So hypertension, very, very early detection is key. So if you're going and you're taking your blood pressure, you know your family has a strong history, you wanna monitor your blood pressure, you wanna monitor what you eat. But you have to teach patients about these things, of how to look for these things. So you wanna do early primary prevention versus secondary prevention. Primary prevention is education, is health promotion, okay? Secondary prevention is screening, okay? Tertiary prevention means I already have the disease and I have to prevent it from getting worse. Okay? So we're going back to your bachelor's degree. We're going to talk about these. Okay? Primary prevention, there's no disease process on board. It's only I need to prevent it from happening. So me to prevent hypertension, I watch what I eat. I exercise on a daily basis. I'm an orange juice fanatic. I go, I love it. I'm one of those adrenaline junkies. I will run 3 miles just to be happy. You know, I'm one of those people. I may have no hips soon, but I'm okay. I won't have hypertension. I'll have no hips, but I won't have hypertension. Okay? How do you prevent the disease from coming? Okay? Health promotion, education. Okay? Specific immunizations. If I don't want the mumps, measles, or rubella, I'm gonna do immunization. One thing you must know, the city of Hollywood has the highest rates of anti-vax in the state of Florida.
Anti-what?
Anti-vax. People who do not immunize their kids.
Yeah.
Are these kids like homeschooled?
No,
No, they're not.
they go to school with other people's kids.
Yeah.
Access and belief. Two issues, okay? But majority is fear and beliefs that prevent it. But the city of Hollywood has the most anti-vax.
In Florida?
So, if that booth is not in your education booth, needs to go there. Okay? Because you have to teach people about the importance of vaccinations if they don't know. Okay? The focus of primary prevention is to improve general health, okay? And you want to improve the health of the community. You can do that passively by just feeding them everything, or actively in getting them engaged. Okay? So primary prevention services, vaccination, and post-exposure prophylaxis for children, these are all primary. Information on behavioral and medical health risks, inclusion of disease prevention programs in primary specialized care levels, nutrition, food supplementation, dental hygiene, a big one. People do not understand the importance of good dental hygiene. Most people do not understand it. There are so many kids. I remember when I took my little cousin to the dentist for the very first time, the dental hygienist came out to me and said to me, "If I did not know you, I would call social services." Because that little girl had never been to the dentist one day in her life. Okay? Not one day. I've paid out of pocket maybe like $7,000 to fix her mouth already. Because I have no access for her for insurance because her mother won't give it to me.
Wow.
But I do that because I work in neurosurgery. And this, very close. okay? And the amount of abscesses I've seen in the brain due to dental abscesses is unbelievable. Okay, so another booth that you definitely need to have, dental hygiene, okay? Very important. Secondary prevention, that's screening. So if I'm doing a mammogram, it's screening, okay? Limited disability, intervention secondary to primary, but applied to individual populations with disease processes. Okay? Population-based screening programs for early detection, provision of maternal and child programs, provision of chemoprophylactic agents to control risk behaviors. Okay? Screening, if I'm already screening, I'm at secondary prevention. If I'm giving education, that's primary prevention. I talk a lot, and so I would never know to give you a break. So you gotta tell me when you need a break. You need a break?
Yes.
Go take a break. I do talk a lot.